Hello, everyone. I'm Siri Vaith, Executive Director of the Cystic Fibrosis Research Institute, or CFRI, and I welcome you to what promises to be an extremely informative podcast about GHPP and CCS with Lynne Kinst. Before we get started, please note that the information and insights shared during this recording, it is not medical or legal advice. So please consult with your care team before making any changes to your health management and/or coverage plan. As always, we thank our sponsors whose support has made this webinar possible: Vertex Pharmaceuticals, Viatris, and Gilead Sciences. Final bit of housekeeping: if you have any questions, please put them in the Q&A box. And now I get to introduce my friend and colleague, Lynne Kinst. Lynne is the Executive Director of the Hemophilia Council of California, or HCC. Lynne says that joining HCC was the perfect opportunity to bring together her passion for advocacy and her love for the bleeding disorders community. Previously, she was the Executive Director of the Central California Hemophilia Foundation, and she has years of political experience working for state elected officials in a variety of capacities, as well as the State Board of Equalization. I personally have had the pleasure of working closely with Lynne on the All Co-Pays Counting California Steering Committee, as well as the California Rare Disease Access Coalition Steering Committee. Lynne is a member of our rare disease community, as her father had hemophilia and she herself has mild hemophilia B. She is a wealth of information on many topics, and our California CF community will benefit from her knowledge and insights on navigating our Genetically Handicapped Persons Program, GHPP, and California Children's Services. Welcome, Lynne.
Thank you so much, Siri. Thank you for having me tonight, and also just for your friendship and partnership. I think one thing that Siri and I are both very committed to is that, we do better as all rare disease patient communities and advocates when we work together. And so it's a real privilege to be able to work together on a variety of issues and to be able to share some information today that hopefully will be helpful, as Siri said, to those of you in the California community about these sort of unique programs that we have in California. So I'm going to jump into the information that we have for all of you, but please do, anything related to insurance is extremely complex and individualized. And so I would just, like Siri said, remind everyone, encourage you, any changes that you consider making, definitely talk to your, really investigate it for yourself. But also I want to encourage you, if you have questions anytime throughout this webinar, please do throw them into the Q&A or the chat box, and we'll try to deal with as many of those as we can. So jumping in just really briefly, so you kind of know where we're coming from. The Hemophilia Council is an organization that was formed back in the early 1980s here in California to focus on advocacy and healthcare access. And we do that with and for the bleeding disorders community in California. We really are excited to partner with rare disease advocates across the state in a variety of disease states where we're all sort of fighting for similar issues. So jumping into these, unique California programs, as Siri indicated, GHPP stands for the Genetically Handicapped Persons Program. It's a program that the state of California formed and funded back in 1975, and it is for patients with specific genetic disorders. So these are inherited or genetic conditions, and they include hemophilia, bleeding disorders, sickle cell, and cystic fibrosis. There are other conditions that are also included under GHPP, but bleeding disorders, sickle cell, and CF are probably the most well-known and largest patient populations that fall under this program. And this program will actually provide comprehensive healthcare coverage. So what I mean by that is basically the number and the type of things that it covers is pretty much the same as Medi-Cal. Any kind of any kind of treatment that you would need that Medi-Cal would cover, GHPP can cover for a patient who is enrolled on GHPP. That means GHPP can be standalone health insurance for a patient that qualifies. Unlike Medi-Cal, which is income-based in terms of your eligibility, eligibility for GHPP is not based on your income, meaning no matter what your income is, if you have a qualifying medical condition, you can qualify for GHPP. The caveat to that is that based on your income, you may have an annual enrollment fee. So we've started to talk about this a little bit, but who is eligible for GHPP? The minimum age is 21 years, so 21 years and older qualify for GHPP. There are some very rare exceptions where if you have a qualifying condition and for some reason you do not qualify for CCS, you may be able to get GHPP under age 21, but that's fairly unusual. So we've talked about this. Qualification is based on a medical condition, and that list includes hemophilia, cystic fibrosis, sickle cell disease, von Willebrand's, and there are some other conditions that are listed out on the GHPP website. You must be a resident of California. Always want to clarify, GHPP does not look at any sort of immigration status documents in order to establish residency. They're looking for proof that you live here in California. So California ID, driver's license, some sort of bill or rental agreement that shows, hey, this is my residence and it's here in California. And again, your eligibility is not determined by your income, but depending on your income, you may have an annual enrollment fee. And that fee, while they do consider it to be an annual fee, and you might kind of correlate that to a premium that you would pay for commercial insurance, but unlike a commercial insurance premium that you would have to pay monthly, they charge it as an annual enrollment fee. But if that annual enrollment fee is too steep for you to pay all at once, you can set it up on a payment plan. Okay, so let me keep going here. I know there's a few questions in the Q&A already, and I think this next slide is going to answer some of them. So what does GHPP cover? So GHPP will cover special care centers. So those in my world are hemophilia treatment centers. I believe you have like certified CF treatment centers. We'll cover hospital stays, outpatient medical, pharmaceutical services that might include some sort of infusion therapy or medication, surgeries, durable medical equipment, etc. So one of the questions is that often you hear that GHPP only covers something related to the genetic condition. That is actually not true. That is true, and we're going to talk about CCS for kids in a minute. But GHPP can pay for any kind of medical condition. It does not have to be related to the genetic disorder or the reason that you were approved for GHPP. I will say one of the challenges with GHPP, and this is where it comes in, that sometimes patients do have a little bit of difficulty accessing services with GHPP, is that it's just such a small program. There are millions of people on Medi-Cal in California. There are only about 1,500 patients statewide on GHPP. So outside of, say, CF centers or hemophilia treatment centers, a lot of the providers are not familiar with GHPP. And so you kind of have to orient the provider like, hey, this is what GHPP is. Here's the website for providers. This is how you go ahead and bill. But any provider that is approved to provide services via Medi-Cal is automatically already approved to provide services via GHPP. The other question is, does GHPP coverage include coverage for specialized drugs like trifecta? And yes, absolutely. Medications, including specialty medications. And, we have a lot of very expensive, important treatment options in hemophilia as well. They are covered under GHPP. Okay, So what is the process? How would you, be able to go about getting your GHPP? So when you do go ahead and start to want to get the application, you'll have to download the application and print it out. It's possible that your provider's office might be able to help you with accessing those forms if you don't have a printer at home, for example. Libraries are also a good place that sometimes you can go and access the internet and print documents if that's a difficulty at home. And so you'll have to go ahead and print that out. You want to make sure that you complete all portions. So one of the things that happens is that people don't completely fill it out, or they miss places that they're supposed to initial, or they don't include one of the documents that's requested, right? And so if you can make sure you fill out all those places, maybe have a trusted advisor or friend that you're comfortable with seeing this information, look through it with you to make sure that you do all of the parts. They are going to ask for financial information. Generally, they will get that off of your latest tax return that you will have to provide. If your financial situation has changed since your last tax return, say you had one job and you made X amount of money and now you have a different job and you're making less money, you can provide documentation of that change along with that tax return, because they will calculate your annual enrollment fee or let you know you have no annual enrollment fee based upon that income information. Okay. And again, proof of residency, it does not have to be a passport or any sort of documents. It's proof of residency is like a cell phone bill or a utility bill or something that shows with your name on it that shows that is correct. That is the address that you live at. The very first time that you apply, you will also have to have documentation of your eligible medical condition. So that is going to be something from your physician that documents, yes, this person has this diagnosis. So this is the CF diagnosis. And that will have to be included. GHPP understands that these are ongoing medical conditions, that you're not just suddenly going to be cured from your CF or your hemophilia. And so the only thing that you don't have to repetitively do each year when you renew your application is you do not have to include the medical reports once you've been approved for GHPP. And then I hinted at this earlier, but your documents can be submitted one of three ways. You can email them, and the email is GHPP eligibility at dhcs.ca.gov. That's on their website, right where the form is. Or you can fax or mail it. Now, and again, those numbers and addresses are all right there on the department's website with the applications. I always encourage people submit it via email. I know it can be a pain to like scan everything in and, be able to email it, but that is the best way to document when you sent it and that you did send it. And also to make sure you have a copy of everything you submitted, because that makes it much easier to follow up with the department if for some reason you don't hear back timely. And you want to try to give them a couple of months lead time if you're making a change to GHPP, or like if you're submitting your application for renewal. But usually it's more like, I would say, around a 2 to 3 week process for them to review and get back to you. Particularly, again, if you do it via email and it doesn't sort of get lost in the shuffle. Okay, and the host did put that information on the webpage in the chat as well. So that's really helpful if you need that. So, okay, say you go through that whole process and you get approved. What does that look like to access services? We had a little bit of a question about that earlier, right? So under GHPP, they will encourage you under GHPP to go to a special care center, or in the case of CF, a CF accredited care center. And there is a link there for how to go about finding those centers on there. You can also check GHPP's website for a list of providers. You are not required to use the providers on that list, but because they are already familiar with GHPP, you may find it is a little bit easier to access those services. Again, in my experience, the special care centers are more familiar with GHPP, so usually you don't have any problems there. Where you can run into being a little bit more difficult is, like, for example, say you need to see your OBGYN and you only have GHPP as your health coverage. You know, there's only, again, 1,500 patients about in the state of California on GHPP. Not very many of them are receiving services from an OBGYN. So you might have to do a little education to your provider to let them know how they can be reimbursed for treating you as a GHPP patient. Okay, so this goes kind of back to your responsibilities. You must meet the eligibility requirements. You must pay the annual enrollment fee if that is applicable. A lot of patients do qualify for GHPP with no annual enrollment fee. You do have to renew annually, which we talked about. It's essentially the same application minus the medical eligibility form. And you're going to want to keep your contact information up to date. This is true no matter what insurance you have. Make sure that your payer, whether it's Medi-Cal or CCS or GHPP or private insurance, make sure that you always keep your address and your email up to date. Otherwise, you may miss some important information that they need that could jeopardize your coverage, right? So keep that information up to date. And I would add, always open mail or, you know, emails from your insurance company or, you know, your payer, to make sure that you everything's current and that you're in a good situation. Also, you can update your financial status if it changes. This is particularly important if you lose, you know, like say you're on a payment plan for your annual enrollment fee and you lose your job. Well, you're going to want to let GHPP know that because they're probably going to waive the remainder of your fee. So you want to keep them up to date on that. And so we've talked about how GHPP can be standalone insurance. It can also be combined with Medi-Cal and or private insurance. So if you qualify for a Medi-Cal and you have a condition that is covered by GHPP like CF, you will qualify for GHPP with no annual enrollment fee. What is the value of having both? The value of having both is that sometimes if you're in a Medi-Cal managed care plan, you may have a harder time getting to, say, like a certified CF center. Sometimes GHPP can help you overcome those barriers. It can also be combined with private insurance. What I will say about that is that GHPP is always the payer of last resort. What that means is if you have Medi-Cal, Medicare, private insurance, any combination of the above, they're going to go to those payers first, and GHPP will come in and pick up things that maybe the other insurance didn't cover. What does that actually look like? That does not mean that GHPP would pay your coinsurance or your copay. It means that if, for example, your private insurance doesn't cover your specialty drug and they deny that coverage, then GHPP would cover that. And so that's some of the ways that it can assist. Let me go ahead and look at the questions in the chat in case they relate to these topics. So it sounds like some patients are sort of out. So, and this is for a patient who I think was on GHPP. So it seems that they've been able to get referrals within the same medical center. And that is often very helpful. Yes, like your provider within one medical center, if your provider is helping to coordinate your other referrals, they can help the other provider be aware of how to bill GHPP, which really helps. And then let's see. The question is, am I understanding that you just said correctly that there is no fee regardless of income if GHPP is secondary insurance? No, that is not correct. So I apologize if that's how that came across. The annual enrollment fee is going to be based on your income, regardless of whether GHPP is your primary or your secondary insurance. And so that is where, like what I mentioned at the beginning, like this type of insurance navigation is very personal and individualized. So I don't personally think that there's ever a downside to go ahead and apply for GHPP if you know that you have a medically eligible condition. And once you know what the annual enrollment fee that they would charge you would be when they come back with that information and say, here's what your annual enrollment fee is. And it could be several $1,000s depending on what your income is, which when you think about that in the context of a premium for healthcare for the entire year, that isn't actually that much money, because many plans would cost, could cost several $1,000s a month, right? But you then have to look at your current plan that you have and how much out of pocket you're having to pay, and whether or not GHPP would be able to would cover that amount, and then see if that really pencils for you individually as a family. We're going to talk in a second about another piece that kind of another calculation that you have to put into that piece. And we'll get to that in just a second. So how do you renew? We talked about this a bit when we talked about the original application, right? So you do have to renew annually. GHPP says that they send out a renewal application and reminders about 2 months ahead of time. We have had situations where patients did not receive that information, either because they changed their contact information or because of a snafu with the department and the applications didn't go out timely. So I always encourage our patients, mark your calendar, know when your renewal deadline is, and get that application in about 2 months or so early so that you avoid any gaps in coverage. And it's basically the same process, except you don't need to document the medical condition again once you're approved. Okay, here's the other little calculation that you would put into this if you were looking at having GHPP possibly as a secondary. There is a program under GHPP that is not very well advertised. It's called the Health Insurance Premium Reimbursement. GHPP may pay the client share of the premiums for your employer-sponsored health insurance. So if you have employer-based insurance and you are paying some of that premium or all of that premium, not the part your employer pays, but the part that you pay, you have to pay it out of your pocket or out of your paycheck, but then you can submit documentation of those payments, and GHPP will reimburse you for the premium. This does not cover co-pays or deductibles, but it will reimburse you for the premium on that plan. This is not applicable for Medi-Cal or Medicare or a plan in which your employer pays for it 100%. But again, as you're making that calculation, if you're paying, if your annual enrollment fee with GHPP, say, is $3,000, but you're paying, $600 a month out of pocket for your health insurance, and you can qualify for the insurance premium reimbursement, that's going to pencil in your favor ultimately for you to go ahead and make GHPP your secondary. Yes. So the question in the chat is, if I have CF and I ended up with lymphedema as a result of pregnancy, would GHPP provide DME and therapy for my lymphedema care? I have private HMO insurance that does not provide DME. Yes, so you could potentially get your DME through, because there is durable medical equipment coverage under GHPP. And the approvals tend to be like the amounts that they cover and what they cover tends to be really similar to Medi-Cal. So you could check out what Medi-Cal's coverage is for the things that you're thinking of. And that would probably be what you would be eligible for under GHPP. Good questions, everyone.
Lynn, can I jump?
I know there are a lot. Yeah.
Can I jump in with a question? In terms of this reimbursement please. For health insurance premiums, so if there is an adult, 21, but not yet 26, so still on the parent's employer insurance, and so the company may be paying for the employee's coverage, but the parent must pay for their adult child dependents premium. How does that work?
That's a good question. I haven't specifically seen a patient that goes through like that. My guess would be they would have to document like typically on insurance premiums, right? There's like, as an employee, there's like 3 different levels. There's like just you, there's 2 people, and then there's like 3 or more people, right? So they might reimburse like the difference to the like, what's the difference between the 2 and the 3 or more? If that makes sense, right? Like, because the child is like the additional person on the coverage, or the difference between 1 and 2, if it's say just a single parent and 1 child. Excuse me. So you would have to document that and they would determine it. I do honestly also know, though, of a case where a patient had transitioned jobs, was on COBRA. The COBRA plan actually encompassed her children because that was just the way it was before. And I believe she ended up getting reimbursed in that case for the whole thing. So, but it's a little like the original, like in the case you're describing, the parent may not have the qualifying condition, right? It's the child that has the qualifying condition in the case you were describing. So it might be, again, that difference between like 1 person and 2 people, on the plan, or 2 people and 3 people, that portion.
Worth exploring, just when you think how many people stay as long as they can on the parent's plan, right? Until 26.
Absolutely.
Window.
And kind of in that vein, I would also say, I'll tell a quick story of a patient with a bleeding disorder who had been, well covered on his parents' insurance, and then he hit that age, bracket and had to roll off, and really thought he had done his homework and, found a covered California plan for himself, which he investigated and said, okay, look, this is like a really great plan and it covers all the prescriptions, so I'll be good. And what he didn't realize was that because his medicine is like a specialty medicine and is like on a different tier, which I know like the type of medicine that we use for bleeding disorders is not necessarily the same thing that's used for CF, but we're both these very expensive specialty meds that are on a totally different tier. And sometimes they're covered under the medical benefit instead of under the pharmacy benefit, or they're just in a different tier than like the regular pharmacy benefit. He thought he had a $15 copay. He had 20% coinsurance instead. So when he got his first bill, filled his medicine for his first time, it was like $5,000. And he was like, they're not covering my med. And I'm like, actually, when I investigated, I was like, actually, they are covering your med, but you have coinsurances, and this is the 20% you owe until you hit your max out of pocket. That kills me, because in that particular patient's case, he would have been so much better off going straight to GHPP and not even having a covered California plan. Because in that case, GHPP as a secondary wouldn't even help, because they don't pay the coinsurance, right? He's better off with GHPP as his primary in that instance. So just kind of an example. And again, everyone's situation is individual and unique. So you really have to kind of look at all the scenarios and figure out which would be the best for your individual, you as an individual patient or for your family as a whole. Yes. Yes, about a one-page handout. I keep saying I'm going to create that, and it's been one of those like time resource issues that I haven't done it. And we need it, because they used to tell us at GHPP, they were like, just have the patient bring their SAR into the provider. And I'm like, the patient has no idea what a SAR is. It's a service authorization request, by the way. But the patient doesn't know what that is. And in what other circumstance do we expect the patient to explain to the provider, like, how to work their insurance, right? So, that's kind of always been an annoying thing to me when people make that comment. I will say this. We did get them to make a change. So now if they put a patient's GHPP, their information in off of their benefit information card, which a new GHPP patient should receive a benefit information card. And now when they put that in the system, if they have GHPP only, it will say, like, this is GHPP and this is where you go to learn more about how to bill GHPP. And it took us forever to get the department to do that, but that is in there now, which will direct patients to, or providers, I should say, to the page on GHPP's website that explains, like, this is how you bill us for a GHPP patient, which is a little bit helpful.
Can I ask one clarification question? So the key is, if, say, it's a broken arm and there's another insurance that gets billed first and they pay their portion, the remainder of it is not eligible for GHPP coverage. If
it's if it's like co-insurance or like a co-payment, if a portion of it, like, you say you end up in the emergency room, and if a portion of the service just isn't covered, then it could be eligible for coverage.
Okay.
It's basically a contracting issue at that point. The state doesn't want to pay a portion of someone else's contracted rate. They want to pay their own contracted rate. So yeah. And then the secondary question to that was, would it be accurate to tell a patient that a provider that accepts Medi-Cal also accepts GHPP? I don't know that that's exactly the accurate way to say it, because you could have a provider that accepts Medi-Cal and that isn't willing to figure out GHPP. But yes, they should be able to take GHPP, would be the distinction. Yes, they are absolutely qualified to take GHPP as a form of payment, but it would be up to the provider as to whether or not they actually would take that payment. So I think there might be another slide here that talks about that a little bit more. So quickly, this is just the contact information off their webpage as to how you can get assistance, and the eligibility mailbox that we provided previously. And then I'm going to talk just a little bit about CCS as well. And I'm probably going to jet through these slides. I think that you're probably more familiar and utilizing CCS more in your community than in GHPP. CCS stands for California Children's Services, which is also a state-funded program for children up to age 21. You also must have a qualifying condition to qualify for CCS, but there are far more qualifying conditions. They are not all genetic, and they are not all sort of permanent health conditions. And this is, I mentioned this earlier, one of the key differences with CCS from GHPP is that CCS only pays for treatments related to the covered condition. So if you have CF and that's why you have CCS, then it's going to pay for everything related to your CF. It isn't going to pay for, say, standard well child visits or, standard vaccinations, for example, or like the broken bone scenario that we talked about earlier, right, that are unrelated to your covered condition. So you can't really have CCS by itself. CCS usually pairs with Medi-Cal, and sometimes it pairs with private insurance. Again, it's only up to age 21. So when the day you turn 21 years old, you are off of CCS. And in our communities, we can transition to GHPP on that 21st birthday if you don't have other coverage in place. And again, you have to be a resident, and there are financial qualifiers for CCS. So you have to meet one of 6 qualifying financial criteria. What does it cover? It covers all kinds of things, but again, only for the covered condition. So doctor visits, care, hospital stays, therapy, medical equipment, supplies, medical therapy programs, medical case management. There's some great things about CCS, again, though, centering around the covered condition. And the application process is a little, typically the provider will help you to do that, and kind of help you work that, help the provider, can help you work that application through. Okay. Another tricky thing about CCS, or something to be aware of, is that CCS is administered at the county level, similar to Medi-Cal. So your CCS eligible condition is the responsibility of CCS in most counties. But then there are also some counties that are under the whole child model, in which case there is a managed care plan that provides services for those CCS kids in that county. Similar to GHPP, you have to meet the eligibility requirements, notify CCS of any changes. Often they will require you to apply for Medi-Cal as part of the CCS application. As I mentioned, they're often paired together if the patients and their family qualify. And update your contact information. One little piece that I'll say about that with the qualification for Medi-Cal and CCS, one of the ways that it differs is, for example, even if you don't meet the normal Medi-Cal income qualifications, you can qualify for CCS if the medical expenses are exceeding 20% of the family's income. So you could have a situation with a family that has high income, but also high medical expenses, and they still might qualify for CCS. So sort of typical things with family members on CCS. Again, because this is geared towards children, they're a little bit more rigorous with some of the things that they're like sort of asking of parents, keep appointments, follow treatment plans, keep CCS informed of medical emergencies or non-scheduled hospitalizations. Typically, your provider is going to help you navigate all of that. And then your renewal is going to be, again, handled by the county office where you live. And like GHPP, the county is supposed to notify you when you're up for renewal. But I always encourage patients, don't wait for the county to contact you. If you know you're coming up for renewal, make sure that you contact them so that you don't have any lapse in coverage. And you're going to have to contact the county office for more information if you need assistance. And I think the final slide has my information again, so we'll talk about that in a little bit. So what are the common reasons that people get delayed? And these are really true across GHPP and CCS. You didn't provide all of the documentation, right? So missing a photo ID, missing verification of your residency or income, pending medical eligibility, or something is just incomplete on the form. Like, always double check that you signed and initialed all the required places. And then what to look out for. I mentioned the BIC card, the benefit information card. That's something that Medi-Cal recipients typically receive, but all GHPP and CCS beneficiaries should also have a BIC card. They don't necessarily replace those annually the way that your insurance card gets replaced annually. So keep it safe. I suggest, in the era of cell phones, you take a photo of the front and the back and mark it as a favorite photo on your phone, and that will make it easier for you to find it if you need to show it to someone. And then, most of us always have our phones on us, so you can have that if for some reason it's not in your wallet. And again, I mentioned this before, but it bears repeating. Don't depend on GHPP or CCS to tell you when you need to send in your renewal information. make sure that you keep track of your renewal date and submit your renewals about 2 months ahead of time. And then we've talked about this a lot. Providers are not always familiar with GHPP and CCS. So unfortunately, you may have to do a little provider education to assist them in helping you to access your benefits. Okay. I'm going to leave this slide up and happy to answer any more questions. I'm sure that Siri has folks there at CFRI if you want to reach out and you're having problems. But I also have our information here. And if anyone calls you guys Siri and you need help with GHPP or CCS, you know how to get a hold of me as well. But we want to, I really believe that GHPP is an underutilized resource for a lot of the rare disease communities that have access to it. And I would love to see more patients really being able to benefit from the I think it does give us a little bit more freedom and flexibility than what many of our, community members have in other states, that we have this resource available to us. I know it's not always the simplest program to navigate, and that causes frustration for patients sometimes, and then they're just like, it's not worth it. But if you can learn how to navigate it, I think that there can be some real benefits for folks. So it says if the provider, so the ER is a Medi-Cal provider, the provider has to accept the Medi-Cal payment. I think it's a Title 21 or 22 issue. However, the provider has to submit its own SAR. We had a nightmare getting the billing department to understand this. The SAR you get yearly is specific to the center you go to. Yeah. So the SAR is very individualized. The SAR is a specific service authorization request. So the SAR is specific to the request that you're making. So yes, they would have to submit their own SAR in order to get billed. What I will tell you, the little sort of secret sauce, is we have a connection with the third-party vendor that handles the billing for these issues. It's a company called Gainwell. And so if you do get in a specific situation like that, where again, like you're saying, if you end up at the ER, they're gonna treat you and figure out the billing after. And so you're gonna get the treatment that you need, but it ends up being a nightmare on the other end with the billing. And we can, if you have specific examples of that in a specific, emergency room or hospital, we can connect them with people at Gainwell, which is the processor, to walk them through, this is how you have to bill this particular issue. And Gainwell would be happy to provide provider training. The problem is it's just, there are so many providers in the state of California and so few patients in comparison that are accessing this program right now. It's hard to necessarily get the provider, all the providers excited about taking a class on this one-off. Maybe we do that, sickle cell and CF and HCC do that together and have that for our patient communities and providers. And since we're kind of the ones that mostly utilize GHPP. So Gainwell is the company. I'll put it in the chat. But if you really get into that situation, you could reach out and we can connect you with a specific person at Gainwell.
Well, this has been so incredibly helpful. And I do feel like it is probably underutilized in the CF community, GHPP specifically. And I think a lot of it is just this misunderstanding. Like I've heard almost every scenario about accessing it. Oh, it wouldn't cover XYZ because they said I had a primary insurance. So I think a lot of people do just get frustrated and are unsure if, once they sign up, is that the wrong decision? Did I do all my calculations correctly? So this has been so helpful, and I'm happy we're going to release this and people will be able to benefit from the front. Now, here's the elephant in the room. My last question for you, Lynn.
Yes.
Is there any discussion about changing that name?
Oh, yeah. I always it's one of those things that honestly, I kind of hate the name, right? But I also kind of a little bit feel like we just want to keep flying under the radar because this is the only health program that this is like a health program that the state runs. It's entirely state funded. Some of the pharmaceutical rebates help pay, like the rebates that the manufacturers have to pay the state helps to pay for GHPP. But unlike Medi-Cal or CCS, where they get huge matching dollars from the federal government, there's no matching funds for GHPP. That's why it's always the payer of last resort. And so when in bad budget times, we're always worried that GHPP is going to end up on the chopping block. And so sometimes I'm like, maybe we just don't draw any attention to ourselves and we just kind of live with the name.
Just keep
But you never know.
And hope nobody asks.
Exactly. At some point, if we ever get an opportunity to do some things, maybe we'll suggest that. So
in the future. Well, Lynne, yes. I cannot thank you enough for sharing your time, your amazing expertise. This has just been so helpful, such a gift to the CF community. And of course, the reason I love working with you. You are so generous to uplift the rare disease community, and I thank you. And I also thank everybody who came and the wonderful engagement with the questions. It is always so much more fun to have a webinar when people are asking lots of questions throughout. And thank you, Lynne, for answering them on the fly. Kept it very dynamic.
Absolutely. Thanks, everyone, for joining us. Have a great evening.
Thank you. Bye-bye.